Welcome to today's session. This is called Building a Support System, Partnering with Communities for Low-Risk Consumption. This is our sixth and final session of our Project Echo series focused on adult low-risk drinking, where we all gain insights into best practices and we come together to share our collective experiences. I'm Sarah Kondrak, and I have the pleasure of hosting the first Project Echo Hub dedicated solely to supporting the behavioral health prevention workforce. There are over 1,400 Echo Hubs across more than 200 countries worldwide, and we're proud to bring this innovative model to Ohio as a resource for the prevention community. Thank you all for being here and joining us. This Echo Hub is housed at the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, and we welcome you to visit our website. It's listed on this slide to learn more about the center's work. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation, or PIRE. Many of you have attended our Project Echo sessions in the past, but if this is your first time at an Echo, welcome. We're so happy to have you here today. At the heart of Project Echo is the philosophy, all teach, all learn. Each session starts with a presentation from an expert on the topic, followed by a community member sharing their work and experiences. The reason Echo is so unique and effective is that everyone here brings their own knowledge and experience and will have an opportunity to learn from one another during the discussion portion of the session. So a key benefit of Project Echo is that the model quickly democratizes access to information and expertise. That means that no matter your location or your professional network, you have access to the latest best practices. Echo ultimately builds workforce capacity by empowering professionals across different sectors with the skills and knowledge that they need to make an impact in their communities. So some practical tips for today. Please mute your microphone when you're not speaking. It is 12 o'clock on the East Coast, so it's lunchtime, and we would love to see your faces. We understand if you can't have your camera on, but this is a time to meet your colleagues and build community. I encourage you to use the chat feature throughout the session, particularly if you want to share resources that are relevant to the discussion. We will capture all of those and post them into iEcho following the session. Finally, please reach out to my wonderful colleague, Nancy Clough, if you're having any technology issues. Nancy's contact information is on the right side of this slide. So we have an incredible hub team that's responsible for ensuring that this series meets your needs. You can identify hub members on this call by looking for the white background and the Echo logo. As a hub team, we're committed to creating an inclusive environment and providing all necessary accommodations. We will start and end sessions on time, and the only recorded part of this will be the didactic presentation. This is really out of respect for your privacy and the community members that you serve. We also ask our participants to help us create a safe and respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting the privacy of everyone involved by keeping discussions confidential. We encourage you to be open and sharing your experiences, knowing that this is a supportive space. So this month, we are concluding both of our Youth Vaping Prevention series and our Adult Low-Risk Drinking Echo series. However, we do have two other echoes that may be of interest to you, and more information can be found on the Center of Excellence website. Just like the others, continuing education credits are offered for all of our Project Echo sessions. So please join us if you're interested. And though this is our final adult low-risk drinking session, the Ohio Center of Excellence for Behavioral Health Prevention and Promotion continues to develop content for Ohio's prevention workforce. With guidance from a statewide adult low-risk drinking advisory committee, 5 asynchronous virtual learning modules are currently being developed around adult low-risk drinking and explore many of the topics that we have discussed in this Echo series. So thank you for all of you sharing your wonderful ideas and resources throughout the series. Those have all been noted, and we're using those in our work. We are also excited to announce that the center will release an adult lower risk drinking playbook in both print and electronic formats with guidance and best practices for making informed choices around alcohol use. The best way to learn more about these resources is by staying tuned to the center's newsletter. And you can also follow us on social media for updates. Finally, I wanted to mention that the center is currently supporting a large media campaign in Ohio called Talk They Hear You, which was developed by SAMHSA. This is a national youth substance use prevention campaign and has really a lot of great resources that might be helpful in your communities. You can find more information on the center's website or SAMHSA website by searching Talk They Hear You. And with that, I would like to introduce you to our presenter today, Mary Francis. Mary is an experienced consultant who develops teams, communities of practice, and provides technical assistance, contributing to behavioral health solutions. Mary consults with Envision Partnerships on its Minimize Risk, Maximize Life course, and for the Ohio School-Based Health Alliance to coordinate Ohio's K through 12 schools, health providers, and families to improve access to quality primary and behavioral health care. Mary also consults with the Ohio Mental Health Network for School Success, partnering with Miami University's Center of Excellence to help Ohio's K through 12 schools, health providers, and families work together to improve access to quality care across the continuum. Previously, Mary served as a senior program officer at Interact for Health and as a director of its Assistance for Substance Use Prevention Center for over 20 years. Prior to that, Mary served as Director of Prevention Services at the Addiction Services Council for 7 years. She was also an adjunct faculty member at the University of Cincinnati's Teachers College for 15 years, where she wrote course syllabi and taught substance use prevention, mental health, crisis intervention courses for UC's Addiction Studies program. Mary worked with Wright State University's SARDI program, writing and teaching about curriculum adaptations for people with disabilities, with the Miami County Recovery Council as a clinician, and served as an AmeriCorps volunteer with Mercy Hospital's Prevention Department, serving the Appalachian community. Much more information about Mary, but we are time limited. So welcome, Mary. We're so excited to learn from all of your experience.
Thanks so much, Sarah. That makes me feel old. Welcome, everyone. It's so exciting to have you here today. Those of you who have an interest in prevention and are experts in the field, I am so excited to have a bit of time here to share about community partners and stakeholders in low-risk drinking initiatives, because they sometimes don't get the value and the connections that are needed for us to really achieve better success in what we're aiming for when it comes to public health. And so important are going back to the very reasons that we do community engagement, which is so that we can have equity in all of our work, throughout our work. If you see the little information slide here, consuming won't make you wise, applying it will. And I know that as I work today with researchers, evaluators, and practitioners, that we're all on the same learning curve. Now, just the briefest of background, what brings us all here is a recognition of the data that shows that alcohol problems aren't getting any better in our community, especially for our adults. We have a lot of data that we focus on with our youth, but when we delve into what is happening with our adults, we know that as startling as the data is, that when we look at our Black and African American community, they have double the representation with alcohol issues as anyone else. And while white is significant and Caucasians have issues, the American Indian population and the Native Hawaiian populations have excessive problems with alcohol use, and we're not talking about it until they need clinical help. My desire is that as we get better and better at looking at adult prevention, and giving it equal focus and attention on the front half of the continuum in our studies and in our activities, that we're going to call out those parts of the community who could use information and data to change behavior. Once folks are educated, they will often do better, and that we can do better at making sure that while there's a prevention opportunity, that we can frame it in ways that look collectively at the issues of alcohol use among adults and come together not just as practitioners delivering education, but as folks who have a stake in the health of the community across the employer base and across our community when its focus is on being the best we can be, whether we're parents or adults living single lives or in constructive educational practices, improving quality of life wherever it exists. Remembering that nothing about us can be planned without us and reach the broader community. So the key factors here won't come as a surprise to any of you. It's just a matter of elevating them to the point of intentionality at each phase so that we can get the broadest impact across our communities. So we're going to focus today on organizing, planning, and networking. And when I go into this topic, there are just a couple of background pieces that Nancy is going to put in the chat box for you that shows some of the background on it. When I was working at that private philanthropic institution, I had the capacity to bring in evaluators from across the nation to help develop some tools that would help us with organizing, planning, and networking. And it's related to the relationship building and relationship mapping tools. You'll find the early iterations of that and the research behind it when you go to those couple of links, because if you're like me, you want to know where it came from and what the background was. The first step is organizing with key partners, having a vision that people agree on, and aligning with the evidence-based projects and practices that are out there to change conditions. There's no surprise that the initial stakeholders involve the communities, the informal groups, the associations in your area, as well as those who are paid to do the work in organizations, agencies, private institutions, and the partnerships with the evaluators, not when we want to learn from the program, but as we develop our initiatives and throughout the process. So brainstorming a list of the key stakeholders with this group is essential. And it proves helpful to really coordinate activities and to capture as many notes as you can and to identify who has what relationships in place and then who has a need and a knowledge of those institutions and organizations and entities who can get outside of our own sphere of influence into those groups and communities that we don't yet have relationships with, because there's so much more to it than simply selecting the community, creating the vision, and having the educational intervention. So we move into systematic planning. Once we've brought our folks together and we've talked about those relationships, let's create some clear, concise, written ways for a couple of reasons. One, so that we can institutionalize those relationships, recognize who's at the table, who could be at the table. The size of the circles can show the amount of influence that those relationships have, and those smaller ones can indicate where we need to build and strengthen relationships. But always, it's the capacity to increase the ownership of the entire community, of the educational opportunity that exists and the needs that arise and the ways that we can influence who gets to the table Have you ever been a part of a really great educational initiative and you don't get to the impact? And it's because the people didn't show up. You secured the funding, you secured the experts, the opportunity is available, the partners who were going to provide the space were all available, and we have the influence in all of those areas. But then we have this opportunity that is no cost to our participants, and it will benefit them through the health of um, their own choices, but they don't get the information because we didn't take time to also establish and build relationships with someone of that community who could help us to spread the word and increase the emphasis on the importance of it, to recognize how and when we're establishing the relationships with those folks who can help us in a way that's beneficial to all. So taking time to use a relationship mapping tool increases the capacity, the ownership as the project matures, and it helps us to delineate both the people who will be involved and the strength of their involvement. I cannot emphasize enough how important it is when we're bringing folks together, when we have the shared vision, when we're clear on the intervention that we want to select, that we take time to map this out in a way that everyone agrees, not just on the conditions that need to be changed and the method to change it, but the process of engaging with each of the folks who can help get us to success, so that we spread the intervention successfully. So when we use the relationship mapping data tool, this is where each individual, and you might be surprised, it can take each individual 15 to 20 minutes between meetings to fill this out with accuracy. It's not as intensive as you might think time-wise, but having a coordinator who gathers up the information from each of the folks. And if you can't get all of your people to provide the information between sessions, then you've got that smaller group who feels maybe a little intimidated by the fact that we're using documenting strategies to make sure that each phase of the process is successful. This is the way that you capture the few rather than the masses to have the activities during a meeting, so that people recognize that everyone is needed in order for our prevention-focused interventions to be successful. And you can have the activity, and it only takes 15 to 20 minutes for people to help you build that initial relationship map with the concentric circles and sizes and colors that are meaningful to you. And what colors you assign isn't as important as the connection that all have in the process of developing a strategy so that we can get those community-based processes right. It's the part that we sometimes put the least amount of energy into and then becomes daunting on the back end of our efforts if we haven't really developed those relationships that are core to the outreach that's needed to get to the community members and to ensure that our equity principles are upheld. So here's some questions that become so critical in helping to analyze our map. You know, who is missing? Once we have the map, and the professionals are really good at this part of it because we spend a great deal of time writing grants and securing funds and monitoring the process. But as we elevate it and increase the number of community-based stakeholders and volunteers who participate, they can help us to get to some of those finer details and to some of those relationships that sometimes don't get the amount of attention until and unless we struggle. And I hope you can't hear my puppy in the background. But when we ask these questions and we get good at building a map, then it's just as important if you didn't notice, up on the right-hand side on the corporate dilemma, how much time do we spend on the process, rather than just giving people a report to read and putting it in a job description for them to carry out. If we're not talking about it, if we're not putting time into repeating the relationship mapping process, then we have those folks who say things to their HR like, I wasn't onboarded properly. I didn't realize that was even part of my duties. I didn't recognize that that is the outcome that you expected of me until I didn't hit the achievement goals that I was hoping for. So knowing that once you're a fine oiled machine and professionals have come along and deliberately done this, that it's just as important to revisit it whenever we have a new staff person come on to assume responsibility for the project, whenever we have new people in the community who show interest or changes in the community and new stakeholders develop an interest who hadn't participated in the past, is such a great time for us to take a moment to look at who needs to be onboarded again and how can we best use the tools that we've already designed that get us to outcomes that are so much more robust than we can do alone as professionals. So if we recognize the coalition focus and we enamor them with the opportunity not just to focus on adults as contributors to the health of youth, but as architects of our own well-being, an opportunity to enhance the efficiency of the pipeline that's professional and to fully take advantage of those interested people who care about but aren't clear on the tactics to best increase and improve the health of the people that they care about. So when we use an evidence-based process, such as the relationship mapping tools, to provide the basis and to get in writing the process and to give people opportunities to then build out and build on the relationships that are so important to the overall success of providing education, we get to collaborate on levels that are more intentional. And sometimes we get the benefit of folks doing the outreach to us to bring us to their tables when they're recognizing that employee problems in separate private industry are being affected and impacted by alcohol. They will come to us and say, what programming do you have that is illustrative of the need and complements what's happening in our EAPs and gets to people why they can still make a change and make a choice. So it's very exciting to get the opportunity to talk about it from the lens of how do we promote and recruit and implement those who care about adult prevention? How do we increase and expand the lens on those who could be contributors in ways that get their bottom line accomplished? And so it's not just a matter of, hey, open the doors for us, let us do this for you on your behalf, or be a host to something that won't cost you any money. It's a matter of how do we engage with people in a way that gives them the opportunity to roll up their sleeves and to say, what could we accomplish that increases the likelihood that people are looking at alcohol in a way that addresses the alarming data that we have related to adult alcohol risky behavior, that gives us a chance to influence behavior among those who find out that if they look at the dimensions of wellness and they recognize that alcohol and their relationship to it is out of proportion for the goals that they have in life, we have an opportunity, if we're talking about it in ways that bring curiosity about who do you think could be a part of this and how do you think we could make a difference, and we remain committed to ways that we can increase the number of people who join us in this effort, and that we're not just talking about ourselves and looking at our piece of the puzzle as something we can do for groups of people, but always with. We have a better chance of getting to those outcomes. One of the things that I had the opportunity to do over the years when I was teaching at UC, it was a prevention certificate course, but it was also allowable. The university looked for ways to get law enforcement, social workers, teachers, educators from different disciplines, and human resource majors to all take the course as an elective so that they could recognize better how we can influence lives around us through evidence-based processes and approaches that exist, but go underutilized because we don't do that community-based process as well as we do picking out the program, delivering it, and evaluating it. So while the relationship mapping tools and resources may or may not be the best fit for you, I can tell you that we vetted them. We used them when I had the opportunities for a couple of decades through the engaged philanthropy work that I did. When we used these tools for public health, we got reach through fire departments, through so many unlikely sources who cared deeply about the issues and had experience to bear on why we needed to address the alcohol issues among adults in the community more widely, and to look at how do we expand those relationships and the amount of impact that we have, and the relationships that go into the process of determining who, what, when, and how. So one of the things that matters greatly to me is that that we have online minimize risk, maximize life, interactive tools that are available, and that we have low risk drinking resources that are available, as well as the opportunity to connect with many professionals who focus on adult living or adult alcohol prevention for a living. So I thank you for the opportunity to discuss this, to discuss some of the tools that elevate community engagement and look at how do we connect for impact when it comes to diversity and equity, in addition to getting the right tools. Thank you.